Hi everyone, my name is Dr. Parissis. Welcome to another video. Today I'm in New York again. I am with Dr. Bloxham, and we thought we would discuss a topic that has come up a lot more recently.
Yeah.
And that is a combination procedure of FUT, strip, and FUE. It's definitely an interesting one, and not something that has been done for many years, but is recently becoming a lot more popular.
Yes, yeah. It's a request that we're getting quite a bit now.
Exactly. So that's why we thought we'd do a kind of everything you need to know about that procedure. We'll go through the pros, the cons, and then we'll illustrate our points with a few case studies. All right. So first of all, in terms of the pros, Dr. Bloxham, what are the main advantages to doing the combination procedure?
Yeah, so I think there's a couple. What I like about this procedure is it's sort of a kind of a best of both worlds. Specifically, there are some definite pros to it. Probably the number one is just the ability to get those large graft numbers. When you mix the two techniques, you're able to get those large graft numbers, and you're able to do it without doing anything inappropriate with either technique. You don't need to take a super wide strip. You don't need to just blast the donor with FUE. You can do a reasonable strip and a reasonable FUE and still get those big graft numbers. So that's probably the number one pro to it, is getting those higher graft numbers. Number two is it does allow you to really have control over what you're doing. A lot of times with strip, or not, I shouldn't say a lot of times, every time with strip, you're never going to know exactly what you're going to get. I'll tell a patient 2,500, 3,000 grafts, I may get 3,072, I may get 2,851. With this method, because you can very much have control over how many FUEs you remove, you take your strip, you say, okay, we were shooting for 3,000, we got 2,412 from the strip. That means I'm not going to do the math on camera, embarrass myself. Yeah. That means we need to do this many as an FUE. So that's nice that it can give you that level of control, and you can make sure that you're really, your patients are walking away happy at the end of the day, because it doesn't matter how beautiful a surgery goes, if the patient walks away with a little less grafts than they thought, it's always kind of like, I wish you would have gotten that little bit more. So that's always nice there. Yeah. The other thing is that it's a very efficient method. If you're one of those guys who says, I just want to do as much as I can, I'd prefer not to come back for multiple procedures, as long as it's safe to do, and we'll get into that in a minute here, it is very efficient. It allows you to get those big numbers, allows you to sort of reduce the number of times you're coming to the clinic to get those surgeries done. So it's very efficient. Your cost is a big one. Typically clinics will charge you less if you're coming in for a bigger session, but it's only one sitting. For example, let's say you need 5,000 grafts. I know at our office, I'm going to charge you less if you're doing 5,000 grafts in one sitting than I would for two 2,500 graft procedures spread out, over 6 months. If you're coming in for a whole separate surgery, it's a whole separate charge. So if you're looking to do, more in one sitting and make it a little bit more cost effective, this is a little bit more cost effective. It's also more cost effective than just doing big FUE, for example. This is going to be, or at least the way I do it, it's more reasonable to do it as the combination.
Yeah. All right, so that's some of the advantages of the combination procedure. I'm going to quickly go through the disadvantages. Don't want to be too negative, but as with every procedure, there are both pros and cons, and it's important to go through that. So obviously the main the main disadvantage to the combination procedure is it takes more time, and it takes more energy for the surgeon and the team. So it's more of a procedure. It's a bigger hit to the patient, to the team, to the surgeon. It's more. There's more to it.
Well, and I think the one you touched on here, I don't know if you're going to do this more, but really the patient. If you're a clinic that's able to do these big combo procedures, I'm going to presume that it's a clinic that has big staff, surgeon that's used to doing these big cases. But you shouldn't underestimate that if you're the patient, because it is challenging to come back for multiple days. Typically, when we do these procedures, not always. You can often do them in one sitting. It's a longer day, obviously, so that's tough on the patient. But sometimes when we're doing these big ones, we're just going for as many grafts as we can safely, and we split it up over 2 days. And that is, that's a tough one. It's a marathon for patients. It can be psychologically a little bit tough. So, make sure that you know exactly what you're getting yourself into. You'll be happy, or my guess, you'll be happy 12 months down the road that you did it. But it's that little period during the surgery itself is going to be a little tougher for you.
Yeah. The other thing I can think of is the disadvantages of this procedure are the disadvantages of doing FUE in general. And there's disadvantages to FUE in that there's a higher risk of transection. You know, the number of grafts that we get that are healthy with FUT is around near 100%, but with FUE, naturally, we transect them. And every surgeon will do this to some extent, regardless of how skillful or experienced they are. FUE by nature is going to result in damage to certain grafts. So in a way, you know, we're using FUE in this combination procedure. You are going to damage more grafts, and you can compromise future strips. But the good thing about at least what we do at Parissis Medical and at Feller and Bloxham is we don't blow out your donor area when we do FUE. We supplement it. You know, the FUT is kind of the main course, and FUE is kind of the side, you know, or the dessert.
That's good. That's good.
The main bulk of your grafts are going to come from your strip, and then you're going to supplement that. It's adjuvant, isn't it? It's supportive.
Not only that, I always tell people that, you know, these strip grafts are the ones that we want to use in the areas that are the most important, the areas that are cosmetically, you know, the most apparent. Not only are we going to get the bulk from it, but those are going to be, you know, the real gold as far as, like, okay, you know, let's say we're doing frontal third on a patient and they also want some in the crown, or they need some in the mid scalp. You know, in my mind, that frontal area is going to be all those strip grafts. So not only am I going to get the numbers because I can focus all my strip grafts there, but they're going to be those highest quality grafts.
For sure. So, Dr. Bloxham, let's jump into some case studies. So we've got some images for you guys. The first patient, I'll let you kind of talk about the pre-op photo here. So first of all, this one.
Yeah, so what we're going to do with these case studies, you know, so I think we kind of went through some of the, like, you know, the theoretical pros and cons of this, you know, technique, of applying this technique to a patient. And what we want to do now is kind of go through some real case examples. And what I like about these case examples, these are all patients that I've done or that we've done in the past probably month, maybe month and a half or 2 months. But they're all different indications. They're different situations where a combination FUT, FUE was a very good approach for different reasons. So this first case we're going to go through here is an FUT, FUE combination that was done because this was a patient that didn't have the best donor in the world, and his donor was a little bit variable. So he had good donor in the occiput, the back here, and what I mean by that is that his density was good back there, but his sides were much less dense. Now, almost everybody has less density in the sides, just the way it is, but his was significantly less dense. So when we looked at his donor, what I said was, you know, I think we could get out and really make it, you know, worth your time to do a strip harvest from the back. The sides, however, I don't know if strip is going to be your best weapon there. The reason why is because strip is extremely good at, you know, taking everything from a certain area. So if you have, you know, really good uniform density and you put your strip in what they call like the sweet spot, you get out everything, it's perfect. If you're one of those patients where you have good stuff to take, it's not that this patient was miniaturizing in the donor, he just didn't have a lot. If you don't have that real concentrated area, if your good stuff is spread out a little bit, typically FUE, even with some of the cons of it, you know, some of the limitations, it typically allows you to access that donor tissue better. And that's how his sides were. So not only could I access it better, but I was also a little bit concerned because his density was lower here about, you know, not only what we would get out with a strip, but also if he'd have to, you know, wear his hair a little bit longer and hide even a good strip scar there. So what we did on him is exactly that, a combination. So you'll see in some of these images, took a strip from the back, then in the same sitting, I went and did FUE on the sides and then a little bit down into the back. And if you look in these, the post-op here, you'll see he was able to get really good graft numbers. I don't have the numbers in front of me, you probably should have done that. But I would say that's probably, you know, 3,300 grafts or so there. That's a really good one. And if you just saw this guy's, you can see even some of those previous ones where his hair is wet and combed up. It's not a good donor, you know, or you can see, yeah, like this is an example. That's not a great donor. You know, if you saw that patient and I told you you're going to get 3,300 grafts from that guy, you'd go, nah, I don't think so. But, you know, with that combination method, with using sort of the best of both worlds, we were able to get out those good graft numbers on him and also put him in a situation where I think he'll be able to kind of trim his hair in the back however he wants, and he's in good shape for more surgery. So that's case number one, a good indication of an FUT, FUE combo in a patient that's got good stuff to take from back here, where we'll take a strip, but not great stuff from the sides. So the next one we'll go through here, this is an indication for FUT, FUE combo in the sense that it was a patient who just wanted to do big surgery. This was a gentleman who was in a little bit of an older age demographic, a little bit of a higher age bracket there. And he said, you know, hair loss is stable, it's been this way for a long time. I'm not the kind of guy that's going to want to come in every couple of years and do touch-ups and multiple procedures and stuff like that. You know, what can you do for me? And I told him, you know, a lot of times with this, what we'll do is we'll do 2 big strips spread like 6 to 12 months apart. He wasn't as interested in that. He said, what can you do for me, you know, on this day or these 2 days? So I said, let's do a combo procedure. So we were shooting for about 5,000 grafts to treat what I would call like a Norwood 5 to 6 here. So we were doing a big FUT the first day, so we got out, you know, probably a little over 3,000 as an FUT the first day, and then sent him back to the hotel to rest, relax. He came back the next day, and we did, you know, a good FUE, about a 2,000 graft FUE or so for that back half. And, you know, again, on this gentleman, I was more confident doing a larger FUE because, you know, he's not a 20-something-year-old guy, he's a 50-something-year-old guy, so we're not as worried about blowing up the donor. And also, we did a big strip in the same sitting, and we've left him in a scenario where he can do more strip, you know, if he needs to, and it's not picked through. We've left some spots where we can take basically untouched strip. But now, if you go to some of these post-ops here, and this is actually when he came back for staples, so if it just looks like there's almost nothing there, this is him 10 days later when he came back for staple removal. I mean, I worked from front to back on that guy, including we did some really pretty corner temple stuff on him. So he was able to, in, you know, 2 days, and it was a marathon 2 days. You know, he'll tell you it was a tough 2 days. But in 2 days, he was able to basically, you know, treat a Norwood 5 to 6 very advanced pattern from front to back. And I don't think we'd be able to do that, or I wouldn't recommend doing it with one technique versus the other. If he just said do it all as a strip, I would have had to have taken out a strip that was way too wide and just would not have closed well, would not have healed well. And if he would have said, you know, give me the turkey treatment and rip out, you know, the entire donor area, it would have not worked well. You know, I think with those hair, not that he's a bad FUE by any means, but you just don't want to take out that many from the donor areas as FUE. Yeah. So that's another good indication there for an FUT FUE combo as a patient who just, you know, needs those big graft numbers and wants to not only get those big graft numbers, but also be in a situation where he can do more down the road. And because we combine the two, he can do more down the road.
Yeah. So really with it, I mean, this patient illustrates 2 really important points really. The first thing is, this is the only way that you can get full coverage from front to back in one session, at least ethically, unless you, obviously, as you said, go outside the donor area with FUE or do 2 strips, which we don't do.
Or take a strip that's 3 centimeters wide where you're, you know,
super wide strip.
You're praying to whoever will listen that it's gonna gonna close.
It just doesn't happen. Yeah. So this is really the only sort of ethical one that works, really, isn't it? It's incredible.
And something I do want to mention about that is, you know, we're going to get into some of the kind of, you know, considerations here of safety. But, you know, when this guy came back for the procedure on the second day, when you do this much of anything in the donor area, it is harder on that vascular supply. And that's everything in scalp surgery is vascular. If you knock out that blood supply, if you're put in a scenario where there's not a good blood supply, you're done. Healing's bad, growing's bad. So had this patient come in, and I purposely put the strip up a little bit higher so it's further away from those big roots, the big, you know, branches of the arteries, and we used a very, very small punch below it. You know, if you're using a big punch below it, that's going to be a problem because you're knocking out more of the blood vessels. But had this patient come in the next day and I started to use that 0.8 millimeter punch and I didn't like the response of the tissue, I would have stopped. You know, but we were able to do these big graft numbers because his, you know, vascular supply was responding well. So not only is this probably the only ethical way to do it, but you still need to take all that into account. You still just can't say, you know, everybody can come in and do this. You have to play it by ear, and if things don't look great the next day, you have to say, unfortunately, you know, for a hair transplant, it's not worth it to risk scalp necrosis or something like that. So we won't do it. But I would say that's a rare indication, but still need to go to an ethical clinic if they're going to do this on you.
So a third patient?
So the third patient here, this is a gentleman who simply requested this. He said, you know, look, I am cool with a small strip scar on the back, and I want it up high, and because of his age demographic, I was okay with this. And he said, I want FUE just kind of, you know, conservatively taken below it, so he could still do the real low fade cuts that he liked. Again, he was a little younger than the previous guy, but still in an age bracket where I was comfortable putting that strip up a little bit higher. You always have a pretty good, you know, kind of buffer where you can put that strip, and I always measure based on, you know, sort of what the data and the research over the years has shown us. But if this guy was, you know, in his early 20s instead of his early 50s, I wouldn't have probably put that strip up as high as I did, but in this patient, I think it's okay. But again, he was said we put that strip a little higher. I'm cool with a strip in the back, but I'd like the size to still be able to be short. I'd like to still be able to do a fade below it. So this is exactly what we did, and got better numbers out on him than I would have expected, and we were able to work in both the crown area and do a nice big front on him.
So the last patient that I want to discuss is a young guy in his 20s who came to us after having an FUE at an outside clinic, and he had this FUE using a robot, so the RTOS robot that is so notorious. So unfortunately he wasn't happy with the growth that he got from that, and he came to us wanting a repair. So that's exactly what we did for him. On day one we went for FUT. Initially we decided on strip, and procedure went well, no complications, but the only issue was that because his donor area was picked out from that previous FUE using the robot, the strip that we got was not enough. There were simply not enough grafts in it. So we thought he's a great candidate for the combination procedure. We brought him back the next day and we did FUE on him to make up for what was lacking.
Yeah.
And yeah.
And he was a little bit, part of the reason he came to us after the robotic FUE that didn't go as well is because he wanted to do strip. He didn't have a great experience with FUE, he wanted to do strip, so did the strip on him, and then when we told him, look, unfortunately we were a little bit short, we can make this up tomorrow with FUE, he was a little, kind of taken aback. He's like, I've done that before. And what we explained to him was, we're going to do it differently. We do all of this very carefully by hand. We're going to use smaller punches. We're going to spread those hits out more. And then what we also told them, and this kind of harkens back to something we discussed before, is that, look, this very crucial area, not that it's not all important, but this very crucial area is done with strip. This is where you need that super high growth. This is where it's kind of going to be the foundation that creates the entire result. It's okay to have those FUE grafts behind it, even if they're not growing at the same level as the strip. Once you've got those big strip grafts in the front and that bulk, you're going to be in good shape. So we convinced him, he came and did it, and it looks great.
Alright guys, so that's 4 patients we went through, and we also talked about the pros, cons, certain things to look out for when you are considering a combination FUT and FUE procedure. Be careful about who you go to for these. They do require quite a lot of skill.
Really make sure that you kind of check out the credentials of the strip aspect of this when you go to another clinic, because it is becoming more popular. I'm sure there could be people in the comments saying, oh no it's not, you just like doing strip. It really is. We're getting a lot of requests for this. Sure. And with everything in elective medicine and surgery, once it starts becoming popular, people are just going to kind of flock to it, including the providers. So my guess is you're going to see more people saying, oh no wait, we've always done strip, we can do strip, we'll do the strip with this. One day deciding you're going to wake up and do strip surgery is not the same thing as one day waking up and deciding I'm going to start doing FUE surgery. It is a different animal, and you need a team that really knows what they're doing. So kind of probe a little bit if someone's offering this to you, specifically about the strip aspect of it, number one. Then number two, make sure that you feel confident with the assessment of sort of the donor health, because like we mentioned a few times, this is a harder hit on the donor. You're doing both techniques. You're increasing the amount of damage to the vasculature, to the sensation in the nervous supply back there. You're taking out more tissue. You're causing more swelling. So this is not for everybody. This isn't just a let's do it and everyone's fine with it. Make sure to ask the clinic, am I good for this? And make sure that you're confident with their answer. Make sure they're not just trying to say, oh, of course you can do it, because it's not just the same thing as just doing FUE or just doing FUT. Now you're combining it. And you want to make sure that your donor can handle that, and you can safely heal up and ride off into the sunset with a good result and with the ability to do more in the future.
For sure. Alright guys, I hope you learned a thing or two about combination FUT and FUE. See you in the next video.